I want to thank you all for taking the time to view this webinar that we've put together. My name is Scott Weissman, and I am a genetic counselor with Genome Medical. I am the lead of cancer and proactive health services. And what I'm going to be doing today is talking to you about proactive genetic testing. So what we're going to do is just really kind of give a basic genetics overview just to make sure we're level setting so everybody has a good understanding of what genetics is, prior to then really diving into what is proactive genetic testing and really thinking about some of the points to think about if you're considering pursuing proactive genetic testing. And then I'll wrap up by talking about who is Genome Medical and how we can help you in this process. A quick disclaimer before we get started, what I'm discussing in this webinar really constitutes general information about genetic testing. I'm not really providing or offering medical advice. I'm not really trying to diagnose anything, and nothing in the webinar should be construed as medical advice or diagnosis. If you're having medical issues, please seek a medical professional advice immediately. And really don't disregard professional medical advice based on anything you've heard in this webinar today. So with that, let's go ahead and start with our basic genetics overview. And some of this may be review, so forgive me if it is, but essentially in every cell in your body, you have the genetic material that makes up you. And that genetic material is stored on chromosomes. And you have 23 pairs of chromosomes, one from mom, one from dad. And the chromosomes are made up of your DNA. And the DNA is basically the unit of life. And it's made up of 4 chemicals that are represented here by the 4 different colors: guanine, adenine, thymine, cytosine. And specifically what they are isn't that important. But what is important to know is that the sequence of those 4 chemicals really are what make up genes. And genes are the unit of DNA that are responsible for producing proteins that your body needs. So genes give you eye color, hair color, tell you how tall you're going to be. And so if you think about all of your genes, that would be considered your genome. And the analogy that I would represent this with is, think of your genome as a book. And if you're reading the book and you really kind of go chapter by chapter, those are all of the chromosomes. And like I said, you have 46 total. And as you dive into the chapter, you start reading the sentences. And the sentences are really the genes. And because you have one set of chromosomes from each parent, you have 2 copies of almost every single gene. And so the genes should form a very specific sentence that your body knows how to read. Any changes to those sentences or the genetic code of the genes can sometimes lead to different health problems. Not all genetic variations are bad, but some can predispose individuals to developing certain conditions. So for instance, in this example here, if you read the sentence, "A great cat ran down a hall," if you change the R in ran to an F, the sentence now reads, "A great cat fan down a hall." And that certainly really has a different meaning than the previous sentence. And that's just, again, trying to get the point across that sometimes genetic variations in the code of your genes can impact the way your body is able to read and respond to your genetic information. Most genetic testing can be done through a blood or a saliva sample. It really has the same level of accuracy. There's no difference between the two. Genetic testing has gotten very flexible. A lot of genetic testing can be done at home these days. And depending upon the type of testing that you're opting for, sometimes the results may take 2 weeks. Other more comprehensive, complex testing can sometimes take maybe a few months to get the test results back. So with that primer, let's go ahead and dive more into what is proactive genetic testing. Proactive genetic testing really by itself is assessing whether an individual has a genetic risk of different things. So for instance, proactive genetic testing can assess whether or not an individual is at risk of developing a specific disease or disorder. it can assess whether or not an individual may potentially be at risk of having a child with a genetic condition. Usually this involves testing the partner to know for sure, and that is often called carrier screening. Or some proactive genetic tests are looking to see if an individual is at an increased risk to having an adverse reaction or not responding well to a specific medication. Proactive genetic tests are generally intended for individuals who are really healthy and don't have a personal history or a strong family history of a specific condition or disorder that they are concerned about. For individuals who may be diagnosed with a new condition or who have a strong family history of a specific issue, proactive genetic testing really is likely not the right way to go, but really what you may want to do is more of a diagnostic genetic test that's going to focus in on genes specifically linked to the condition or the disorder that you and your physicians are concerned about. And proactive genetic testing is mostly done for adults, though some laboratories do offer tests for children looking to assess whether or not a child is at risk of developing a childhood onset disorder. Most children, when they're born in the United States, have some type of genetic testing that's called newborn screening. And many of the proactive genetic tests that are available out there are really more of a supplement to newborn screening and test for many more conditions than many states do. In terms of the type of information that you can get from proactive genetic testing, I usually like to break it down into two general categories. Some of the tests that are available only offer actionable information. And actionable information would be conditions where there's something that you can do about the information. There's either a screening test that would allow you to diagnose the condition earlier. There is a treatment available for that condition, or perhaps there are preventative things that you can do from preventing that condition ever developing. So things that may fall into the actionable category would be blood disorders, cancer, certain cardiac conditions. Again, we talked about carrier screening a little bit just a few moments ago, diabetes risk, and then that concept of medication avoidance or choosing the right medication based on somebody's genetic makeup is called pharmacogenetics. So again, all these things would be actionable where there's something practical that you and your doctor could do by knowing whether or not there was a risk for one of these conditions. Things that may not be actionable are, let's say, childhood onset genetic disorders that are lethal, meaning there's no treatment, there's no cure, and if the child goes on to develop this specific condition, it likely, unfortunately, will take the child's life. There are neurologic conditions where there aren't necessarily things that you can do. So things like Alzheimer's disease or Parkinson's that we'll come back and talk a little bit more about. There are genetic markers that are called risk alleles that are genetic findings that can slightly increase the risk of developing a certain condition, but usually by themselves aren't enough to cause a disease of interest. And so practically risk alleles may not actually be actionable. And then sometimes undergoing this type of genetic testing can lead to unexpected findings that again aren't necessarily actionable that we'll talk a little bit more about. So if we go into a little bit more detail about the actionable conditions, let's start with blood disorders, which is the first one on the previous list. So there are certain genetic factors that can increase the possibility of developing certain conditions with the blood. So one of which would be, let's say, a hereditary risk for developing blood clots. So knowing that information may allow you and your physician to come up with a plan to, let's say, maybe avoid smoking, avoid certain medications. For women, it may be avoiding supplemental estrogen, maybe doing practical things like when on an airplane and maybe you're immobile for a long period of time, making sure that you're getting up and walking around to kind of get the blood flowing to minimize the chance of anything happening. Other times there's certain known genetic conditions that can cause blood problems. So an example of a common blood disorder is something that's called hereditary hemochromatosis, which can lead to the body storing too much iron, which in turn can cause other problems, things like diabetes, cirrhosis of the liver, potentially pancreatitis and other problems with the pancreas. So a lot of different issues there. But if you know that somebody's at risk of developing hemochromatosis, it can be treated very simply by that individual donating blood every few months to lower the iron levels in the body. So again, two examples of blood conditions that would be actionable by knowing whether or not there was a risk there. Different cancers can be actionable. So if somebody knows that they face a higher risk for developing certain cancers, it may lead you and your physician to screening for these cancers maybe at an earlier age or being screened more frequently. It may involve using screening tests that are not commonly used. An example of that may be if a woman is at an increased risk of developing breast cancer, it may be that she should not only be having a mammogram once a year, but also an imaging test that's called a breast MRI once a year as well to lead to early cancer detection. And then for some cancers, there's actually preventative steps that you can take to prevent a cancer from ever occurring. So there are certain medications that can reduce the risk of certain cancers, or in some cases, it may be a surgical course where providing a surgery can reduce the risk. An example of that would, let's say, be women who face a higher risk of ovarian cancer. When a woman is done having her family and she's, let's say, reaching her 40s, you may think about removing the ovaries and fallopian tubes to preventing an ovarian cancer from occurring. Cardiovascular conditions. So there are many different types of cardiovascular conditions that can actually have a hereditary component to them. So the first there listed is aortic dilation or aneurysms. So this is when the main blood vessel of the body, the aorta, can potentially be at a genetic risk for expanding or becoming larger than it should be. And if it gets too large, it can sometimes rupture, which is another term for aneurysm. There are genetic causes to arrhythmias or kind of an electrical problem with the heart that leads to an irregular heartbeat. There's a group of conditions that are called cardiomyopathies, which can lead to the development of an enlarged heart. And then some people have really high levels of cholesterol. We're talking 300 or higher that can predispose them to developing coronary artery disease and other problems. So the action that you can take by knowing that there is maybe a high risk for one of these different cardiac conditions can again be leading to increased screening with echocardiograms, EKGs, or potentially lipid tests for people at high risk for developing high levels of cholesterol. Again, you would start screening at earlier ages, and you would do screening more frequently. There are certain medications that can be used that really effectively treat high levels of cholesterol or minimize the risk of developing an arrhythmia. And then for individuals that perhaps are at really high risk due to a specific gene of having a sudden cardiac event due to an arrhythmia or a cardiomyopathy, you may actually do something more preventative where you would put in a implantable cardioverter defibrillator that would basically be there to restart the heart if the heart ever suddenly stopped. Again, some examples of other actionable conditions: carrier screening. As I mentioned earlier, this is a type of testing where it is identifying whether or not there's a chance of having a child with a genetic disorder. Typically, people who are carriers don't really have any specific health implications that impact them. But if you know that somebody is a carrier for a condition, you can test their partner to see if he or she is a carrier for the same condition. And if it turns out that a couple are both carriers for the exact same condition, then it opens the opportunity for that couple to investigate different reproductive options if the couple wants to know potentially how to minimize the chance of having a child with that particular genetic condition. There are some rare single gene forms of diabetes that can really cause early onset forms of diabetes, as well as cause different types of diabetes that don't respond to typical treatments. And so if you know somebody was at risk of developing one of these forms of diabetes, you may want to monitor them more closely for signs and symptoms. And as I just mentioned, some of these hereditary forms of diabetes, you want to either provide specific treatments that you know will treat it, or you're going to want to avoid certain therapies because you know they're not going to work. And then finally, with pharmacogenetics, again, this is testing that is looking to see if there is an explanation for individuals that maybe aren't responding to certain medications or are having kind of continuous adverse reactions to medications. There's also some rare conditions that can cause sudden death in individuals that are exposed to certain types of anesthetics used for surgeries. So with pharmacogenetic testing, what you can do with knowing that information is you and your physician can really prescribe an optimal medication right at the outset of trying to treat a new condition, or you can get an individual to the right dose of a medication at the outset. And again, for the more serious situation where you're talking about anesthetics leading to death, knowing that could lead a physician and an anesthesiologist to make sure that you're getting the right type of anesthetics to minimize the chance of any significant adverse reaction occurring during a surgery. I want to spend a few moments also talking about some of the non-actionable conditions that, some proactive genetic tests include non-actionable conditions and others do not. Again, we talked about kind of the lethal childhood onset condition where there's no treatment or cure and the child will unfortunately likely pass from the disorder. Or there's neurologic disorders like certain types of dementias, like Alzheimer's disease, certain movement disorders like Parkinson's disease or certain types of ataxia and other neurologic conditions, where knowing this information really can have significant impact, where as an individual, you may be waiting for the disease to onset, and that may cause undue anxiety and stress. If you're a family member of somebody who's found to be at risk of one of these conditions, it can be challenging where maybe you're always looking at that healthy individual as sick because there's a strong chance that something may happen down the road. Again, for many of these conditions, there's really no treatment or no cure. And so knowing can just be just that. You know that there's a risk, but there's nothing actionable that you can take to do about it. And sometimes that can lead to psychological harm long-term of knowing about a potential risk that there isn't something practical that you can do with the information. Switching gears to risk alleles. So as I talked about earlier, these are genetic markers that are associated with the condition, but by itself are not causative. So things like celiac disease, pancreatitis, which is inflammation of the pancreas. There are certain types of risk alleles that have been linked to Alzheimer's disease and something that's called pulmonary fibrosis, which basically leads to the lungs being scarred and difficulty breathing. There are lots of genetic markers that have been linked to these conditions, but they just really kind of slightly elevate the chance of developing these conditions. And again, there really isn't anything that you would do differently until potentially a point down the road where if a symptom were to manifest, then you would treat it at that point in time. But knowing before symptoms manifest, you really wouldn't do anything differently. And then with really any type of genetic testing, not just proactive genetic testing, but really any type of genetic testing, sometimes there can be unexpected findings where an individual ends up having a positive genetic test result for a condition that the individual never actually developed. Maybe it's an adult who's found to have been at risk for a childhood onset condition that they never developed, or maybe has yet to develop it. So maybe they didn't develop it in childhood, but perhaps there's some late onset manifestations that can occur at some point down the road, which would be unexpected. Sometimes when the genetic test results come back, there's genetic variants that are reported that don't have a clear association with the disease of interest that gene is known to cause. And so what can happen is that knowing that information can make it unclear as to whether or not a screening or an intervention is needed, as well as what the potential risks would be for other family members. And then sometimes when genetic testing is done, it can lead to new family dynamics, or potentially, non-paternity can be disclosed, or potentially sometimes you may identify a other relative that you didn't know was really part of your family. So these are all things to think about when really any genetic test is done, but can sometimes also come out of proactive genetic testing. Right now, there are really two different proactive genetic test options. So one test is more of a panel test where a laboratory has put together a specific set of genes that they have determined are important to know about because they're typically actionable conditions. The genes on this panel may cover one condition. So for example, it may be a proactive genetic test that's only looking at cancer genes, or maybe a panel of genes that's looking at different types of conditions. So perhaps it's looking at cancer genes, it's looking at carrier screening, it's looking at cardiovascular disease. So you can get lots of information out of it. Typically, these panel tests are testing the genes in full, meaning if you think about, again, the gene being a sentence, the genetic testing is really reading the code from the beginning of the sentence to the end of the sentence without missing any of the genetic information. The panel testing typically doesn't include non-actionable information or risk alleles. Again, some do, but most don't. And the cost of this type of panel testing is anywhere from maybe $250 to $500. And typically when you're talking about proactive genetic testing, these are genetic tests that are going to be more of a self-pay option. Health insurance companies are not going to cover a genetic test when there really isn't a medical indication where it's more of somebody's curiosity and wanting to be proactive about their health. Although it sounds fine and well, it's just something that insurance companies really don't typically cover. The other type of testing option is something that's known as genome sequencing. And this is genetic testing that's really looking at thousands of genes that would typically cover many different types of conditions. Most genome sequencing covers actionable information with the option of receiving non-actionable conditions as well. Some laboratories that are out there, they may test for the thousands of genes, but only report out a subset of the thousands, while other laboratories may report out anything and everything that they find. With the way genome sequencing is done, sometimes the testing of genes isn't as complete as a panel test. So with a genome sequence, perhaps maybe 95% of the gene is covered, whereas as a panel test, you may have up to 99% of the gene covered. Typically, genome sequencing includes the non-actionable risk alleles. And then the cost of genome sequencing can range anywhere from $500 to really thousands of dollars, depending upon the laboratory and the amount of information that the laboratory is going to be reporting back. With any type of proactive genetic test results, there's typically one of two results that somebody would get back. The first result could be that the results are positive. Positive basically means that a genetic variant was identified that's known to be associated with a hereditary condition. So those types of variants are called pathogenic or likely pathogenic variants, or you may be more familiar with the term mutation. And so with positive results, typically it confers an increased risk of developing that condition. It's not necessarily a diagnosis. So again, let's take our cardiovascular example where maybe their gene is positive for a cardiomyopathy. It doesn't necessarily mean right then and there that you may have an enlarged heart. It just may mean that there's a risk of developing one at some point in your lifetime. If carrier screening is done, a positive result would then indicate that your partner needs testing to really assess the chance of having a child with that condition. If the results are positive, at that point we would know that there is a genetic predisposition in the family, and therefore other family members would be at risk of having the same genetic variant, and other family members may need genetic testing at that point to assess their risk, with the exception being pharmacogenetics. Pharmacogenetics is really more of an individualized test that takes into account the genetics from both mom and dad and the combination of genetics to really assess an individual's response to certain medications. So for carrier screening, for cancer, for cardiac disease, that's something that typically can be shared with other family members. But again, pharmacogenetics is really individual to the one person that was tested. So most people that go through proactive genetic testing actually end up with negative results. And negative results would mean that there was no genetic variant identified that's been linked to a hereditary condition. A negative result reduces the risk, but does not rule out the chance of developing the condition. You could still develop one of these diseases due to non-genetic causes. So just because, let's say, all the cancer genes come back normal, it doesn't mean that there's no chance of developing cancer. It just means that your chance of developing cancer would appear to be just like everybody else in the general population. The results could be negative because perhaps, depending upon the test, not all of the genes associated with a particular condition were tested. Some of the proactive tests just look at very common genes. They don't necessarily look at rare causes of certain conditions. And no genetic test is really perfect. All genetic testing could potentially miss certain types of genetic variations that can occur. So for these different reasons, a negative or normal result does not completely rule out a condition. And a negative test result doesn't mean that other family members are not at risk. It is possible that although you had a negative proactive genetic test result, it is possible that there's a genetic condition running in the family, and a sibling, a child, a parent, if they were to go through testing, they could potentially have a positive result. So now that we've spent some time talking about proactive genetic testing and what it is and how it can be done, it's really important to spend some time talking about things to consider when it comes to making a decision about proactive genetic testing and whether it makes sense for an individual. Really the first thing to think about is, what are your interests and motivations for considering genetic testing? Are you trying to be preventative with your health, trying to lead to perhaps early detection of certain conditions? Do you have specific medical concerns? And as I mentioned at the beginning of the talk, if there are specific medical concerns you have, it's possible that another test may be appropriate, or it may be appropriate to test a different family member and not yourself. And so in those situations where there may be a specific concern that you want to know more about, there would be a benefit in speaking with the genetic counselor to figure out if genetic testing makes sense in your family. Some people may want to consider proactive genetic testing because they're considering planning a family and they want to be able to better set themselves up to have individuals that are less likely to have a genetic condition in future generations. Other people may want to consider this for insurance planning. They're thinking about getting life insurance or long-term care insurance, or maybe even financial planning. And so getting a better sense of what their future genetic risks may be would allow and help with that type of financial planning. It's, again, always important to consider the potential benefits of having the information. So how the information can help you and your physician really make informed decisions about your health based on genetic risks. And it's also important to really kind of play the what if game with yourself when it comes to thinking about proactive genetic testing, meaning taking some time to think about how you might feel if you have a positive test result and you identify that you're now at risk of developing a certain condition. Or what would happen, do you think, if you ended up having an unexpected finding that you really hadn't thought would come up? Or what would you do with the possibility if the test results came back that there really was nothing clinically relevant? Some people really go through this and end up being a little bit disappointed that the results come back completely normal. Ultimately, that's a good thing. But again, really kind of getting a sense of how you might feel depending upon the results and what they may show. It's also important that when you're thinking about proactive genetic testing, that you're taking this test at one point in time. Our knowledge about genes linked to specific conditions and different genetic variants within genes is constantly evolving. So information that we know in 2020 is likely going to be vastly different from what we know in 2025. And so any genetic testing that's done now, it's important to know that our knowledge is constantly evolving. And so even though there was maybe, let's say, a negative test in the current time, if our knowledge were to change, it's possible that something could be identified down the road. Sometimes these changes may result in differences between, again, the genes that are included in a prior genetic test versus current tests. And occasionally, sometimes our understanding of how variants in genes differ. And so very rarely, but occasionally, you can have a variant that's identified that's called a positive result. But as we learn more about that particular variant over the course of time, it may be discovered that that variant really doesn't impact the gene and doesn't predispose to that disease. And there can be some worry and concern and some frustration that perhaps you've been screening for the past several years and it turns out, well, maybe you didn't need to be doing all of those tests to begin with. And so, because of these differences, if you've had previous genetic testing, it doesn't negate the need for current testing or perhaps even future testing. So this isn't always kind of a one test and you're done type of a situation. And it's also, again, it's important to know that before going in, because again, some people have the impression that when they do a proactive genetic test that it's done at one point and then it's never needed again. One of the questions that we get a lot when talking about this are things about access to genetic data and privacy. There are federal laws that prevent any kind of discrimination when it comes to health insurance or employers based on genetic risks. A genetic test result really cannot be considered a pre-existing condition. There is the Genetic Information Non-Discrimination Act that covers that specifically, but the Affordable Care Act, as well as the HIPAA Act, also provide different levels of coverage. Unfortunately, there's no federal protection against other types of insurance. So things like life insurance, long-term care, disability, there are no federal laws offering protections. And that really comes down to state laws. There are some states that do offer protections. There are others that do not. So it's something that's important to know when thinking about doing this testing. And finally, the laboratories that we typically work with are laboratories that are never going to sell your data or share your results without your consent. So in our minds, this type of testing is really different from the stuff that you can order by yourself at home. So we feel very confident that your genetic data is being protected by the laboratories that we typically order genetic testing from. The final point to consider is really the family implications. So if you were to choose to undergo a proactive genetic test and something was identified, at that point, it is possible that other family members may be at risk. So there are many conditions that are covered on these proactive tests that are dominant in nature, which basically means that if you were found to have a dominant condition, each of your children, each of your siblings, and your parents would all have a 50-50 chance of having the same genetic risk factor. In very rare cases, the individual who tests positive is the first individual in the family to have the genetic mutation or pathogenic variant identified. Again, very rare, but that can happen. Other conditions are recessive in nature, where both parents, let's say, need to be carriers before they can have a child with that condition. And if both parents are carriers, every time that couple were to conceive a child, there would be a 25% or a 1 in 4 chance that their child would be at risk of developing that condition. So anytime you consider genetic testing, if the results end up being positive, it's not really only going to impact you, but it's likely going to impact your immediate and more distant relatives as well. So finally, I just want to finish up by talking a little bit about Genome Medical and who we are and what we do. So at Genome Medical, we really have a commitment to the medical responsible use of genomic information. And Genome Medical has really put together top minds in the field of genetics to help develop our clinical testing programs. And we developed those programs with really a patient being at the center of the care that we're giving. I know the term is used a lot, but we provide precision medicine that is really patient-centered. And so the team at Genome Medical is made up of not only genetic counselors like myself, but we have medical geneticists who are physicians trained in genetics. We have primary care physicians that can help with test ordering and management. We have a team of pharmacists that can help work with your physicians to make sure that you're getting the best medications possible. And then we really couldn't do anything without our amazing team of care coordinators who really end up being the point person for working with our patients, help scheduling appointments, helping them coordinate genetic testing, getting them their genetic test results. So really a key component to the Genome Medical team. Our platform is a telegenomics platform. So we see patients via video or via phone. And we have an online portal where individuals can sign up for their own appointments, get test results, get our test summaries, what we call our clinical action plans, all via a web-based portal. And we have well over 50 clinicians on our team who average about 10 years of clinical experience. We are licensed in every state that requires licensure, so we're able to provide genetic services across all 50 states. And we're generally able to see patients within 48 hours of when they would like to be seen. And we cover the spectrum of genetic conditions. So like I mentioned at the beginning, I'm very much involved in the cancer and the proactive services. We have our cardiogenetics team. We have a team of genetic counselors that are very much involved in reproductive and prenatal testing. Our medical geneticists and our genetic counselors are actively involved in helping children that may be showing or manifesting signs or symptoms of a genetic disorder. And then again, our pharmacists with our pharmacogenetics program. And what's really great about the fact that we cover all different disciplines of medical genetics is that we're really able to support individuals and their families through the life cycle. We really can work with individuals as young as infants, all the way to adults who are later in life and again, perhaps are developing some condition that needs help assessing to see if there's a genetic cause to it. So if you heard something in this presentation that really makes you think you want to talk more with us about proactive genetic testing, you can schedule your own appointment at genomemedical.com/proactive-health, or you can call and speak to one of our care coordinators. You can call them at 877-688-0992. So I want to thank you very much for your time and attention during this webinar. And again, please reach out to us if you have any questions. Thanks for your time.